Going to try and answer this to the best of my ability, and don't worry, this is not on. I'm just sitting here because I decided right before we left that I needed a sense of control, so I cut myself straight across bangs. And a humid, hot climate was not the best idea for that. Anyways, I didn't bring like a thick curler thing to put into it, so I'm trying to get it to dry before we go to dinner. Anyways, as far as will it ultimately heal or undo the autism, so essentially autism is actually like a blanket term, and it just kind of refers to some sort of delay, whether it be like cognitive function, communication, like speech. Like they kind of just use it when they don't really know the true culprit, as autism is like defined by like a developmental delay in some form or fashion. And that's kind of how they base the levels. It's like they have like criteria in the States where they do like used to be a CARS, so it looked like CARS exam. They did away with that and they use a different one, but I don't remember. Anyways, Oscar was done on a different scale, but I know like in India and here, they run off the same one. It's like the Indian scale, and honestly, they're very similar, and it's kind of like, how functional are they at life? Can they communicate in any form or fashion? Are they verbal in any form or fashion, and all of these different things? Anyways, moral of my story, autism is kind of a blanket term. You can't necessarily say that like autism is considered heterogeneous. No one knows the true cause. Can it be, like some sort of genetic makeup? Possibly. Can it be some sort of traumatic event? Possibly. Scientists are kind of dumbfounded because so many people have been like put in that blanketed terms section that they can't necessarily say, oh, it was for sure this factor. Anyways, so to answer your question, I think it really depends on the patient, and I don't necessarily I think that like because it's any type of delay, can a child no longer be delayed? Yes, I think that's totally accurate, and you could say that. How far can stem cells get a child? Well, stem cells can only allow for there to be improvement. So like they are essentially fixing anything, like, so genetically speaking, let's say something is missing or something is broken, stem cells have the ability to go in that area and fix said thing. Will that make like some colossal like developmental increase? Possibly. We feel like that's what we saw with our son, but that's not always the case. I think it's very case-to-case basis, very, patient-to-patient. But I do know that they treat it like Parkinson's, autism's been treated, orthopedics. It's kind of like, oh, you tore your meniscus, let's inject some stem cells because they will then become part of like the material that they need to heal that. Anyways, but I hope that helps. Essentially what we're looking to do is just help our son with like functionality for life. I just want him to socially be able to know who should be in my diaper when I'm at therapy. Should I let some random person in my diaper? Should I then tell someone? Do I feel safe? Do I not feel safe? How can I defend myself when my parents aren't around? We just want to make sure he's functional to that extent where it's like he can tell us if he's being abused. Obviously, like we go to a clinic where there are cameras and all these things and we do our own checks and balances, but he's very much easy prey for someone with malicious intent, okay? And that's what we're trying to stop. We're trying to give him the ability to protect himself, communicate to us when something's being done that isn't supposed to be being done. We hope to never put him in that kind of a position, but we also will eventually die and he will likely outlive us. So yeah, that's kind of our goal. Do I care if he, in my form or fashion, like if he was the complete opposite of me and he liked it that way, I'm totally fine with that. Quirky, whatever you want. I'm OCD. If he wants to be OCD in a different way, I'm totally fine with it. But when it comes to functionality of life, I don't just want what the diagnosis said. They said he would be a vegetable. They said that he would be literally institutionalized by the time he hit adolescence because he would be too aggressive, and which before the first round of stem cells, literally our daughter did not go near a staircase because he would push her down every single time. She wouldn't even go near him. Now after stem cells, they play together, they sit, he tolerates her. Obviously they're still siblings, so there's still a little bit of, she tries to bite him, he then, flicks her in the mouth, just stuff like that. But that's completely different than before, and so we just care about functionality of life. I hope that makes sense. But anyways, I think we're gonna go to dinner. That's as good as these bangs are getting.